ENT images, which are frequently asked in the previous year examinations of the NEET PG and INI-CET. Firstly, we will be starting with the X-rays, which are commonly asked in the ENT section. The following images of the Waters view. Waters view is basically for maxillary sinus. As in this image, we can see the maxillary sinus. Then next we have after the Waters view, we next have the Cadwell's view. Cadwell's view is for frontal and ethmoid sinus. Cadwell's view is for frontal and ethmoid sinus. This is visible in this image. Then next we have the Pires view. Pires view is basically Waters view with the open mouth, and it is for sphenoid sinuses. So these three views are mainly to be remembered for the exam. Then we have the implants. It is a cochlear implant. Cochlear implant is placed in the scala tympani, and its basic indication is Mondini's dysplasia, while contraindication is Michael aplasia. Aplasia we need to remember like this. Aplasia, there is no cochlea, so where we will implant it? So indication is Mondini's dysplasia, and the minimum age for implantation is 1 year. Then next we have the stapes prosthesis. Then we have the bone anchored hearing aid. Bone anchored hearing aid, clue that it is outside the ear. It is basically used in canal atresia, where we can't use in the ear hearing aid, so bone anchored hearing aid is used, and it can also be used in children with the sensory neural hearing deafness, sensory neural hearing loss below the age of 1 year, where we can't use the cochlear implant. Then we have the ossicular replacement prosthesis. Then coming back to this image, this is image related to Gold-Hinar syndrome, that is oculo-auriculo-vertebral anomalies. In this we have the anomalies related to eye, then auricle means ear, and vertebral anomalies. Basically in the ear the finding is microtia. Then next in this X-ray we have the this arrows are pointing towards the thing which is slightly above the orbits, and it is on the lateral side, not in the median. If the arrow was in the median, then we would have easily said that it is a septum, but here the arrow is in lateral, and it is for the anterior ethmoidal artery canal. It is pointing towards the anterior ethmoidal artery canal. Then next we have the image of the allergic fungal sinusitis. How we will identify allergic fungal sinusitis? In it is basically that there will be heterogeneous appearance. Heterogeneous appearance of the mass, and in between the calcifications would be present. Then next we have the image of the vestibular schwannoma. It is an MRI image of the vestibular schwannoma, the 8th nerve tumor, which typically appearance is eyes cone appearance. Eyes cone appearance. This is. And then we have the endoscopic image. Endoscopic image shows the in the medial part we have the septum, and lateral wall. Lateral wall there is a turbinate, and which turbinate is most conspicuous? That is inferior turbinate. So here is nasal septum and inferior turbinate shown in the image. Then in the next image we have this radiographic image of the basically the turbinates of the nose, paranasal sinuses. This is normal middle turbinates, and straight nasal, normal middle turbinates and straight nasal septum. Then we have the normal inferior turbinate, normal, and there is no pneumatization in the turbinates. Then here in this image we will see from the below, this is inferior turbinates, then these are the middle turbinates, and these are the superior turbinates, and here we can see the blackishness in the superior turbinate. So it is called the pneumatization of the right superior turbinate. Pneumatization of the superior turbinate. Then here is one more endoscopic image. In this image we can see this is the epiglottis, these are the vocal cords, and these are the aryepiglottic folds. And outside the our larynx, these we have the piriform fossas, and there is post-cricoid space. This full space is known as post-cricoid space. Piriform fossa is important because here it is mainly site for foreign body lodgement, and then piriform fossa is mainly site for foreign body lodgement, and hypopharynx malignancy is basically in the post-cricoid space, and in the it is important association in the Plummer-Vinson syndrome in the females. Then this we have the battle sign. Battle sign is basically bluish discoloration behind the ear. It is mastoid ecchymosis seen in the blunt trauma cases. Then here we have some instruments. Perkins self-retaining hemostatic mastoid retractor. What we basically use in the identification of this is that it has these blades, tipped blades, and this is flat blade. This we will use to differentiate it from the other instruments. In this instrument, both the blades are the toothed blades, so it is Janssen mastoid retractor. Mastoid retractor, and this both tooth blade is Janssen, and Perkins is one flat blade. Then we have the next one is Whitlanner's. Whitlanner self-retraining retractor. It is also both tooth blades, but these are different. Like this is basically scissor shaped, while Jensen's was not scissor shaped. So this we can differentiate from it. And Joel's thyroid retractor. From the shape only we can identify that it would be used for thyroid. Joel's thyroid retractor. Then next, these are the important images we are starting with. These are basically very much frequently asked in the exams. The first one is the bulla ethmoidalis. Bulla ethmoidalis is the largest ethmoid cell. The largest one which you will see in the view in the ethmoid region, that will be bulla ethmoidalis. Then this we have the agar nasai and onodi cell. These are interior and posterior. These will be basically seen in the anterior-posterior views. Agar nasai is the anterior most ethmoid cell. Agar nasai is basically the anterior most ethmoid cell. Then we have the firstly we will see the onodi cell. Onodi cell is the posterior most ethmoid cell, and onodi cell lies in relation to the optic nerve. Onodi cells lies in relation to the optic nerve. Then we have seen anterior, posterior, and the largest. Then now one more important cell, the cell which lies in the floor of the orbit, or we can say the roof of the maxillary sinus. This is our Haller cell. Haller cell. Then coming to the middle turbinate, if middle turbinate is pneumatized, we see this is inferior turbinate, this is middle turbinate, this is superior turbinates. So in the middle turbinate we have the pneumatization, and it is called concha bullosa. It is the most common pathology in the ENT. We see these in very much population. Then coming to the rehab devices frequently used in the total laryngectomy patient for voice rehab. This is electrolarynx. It is looking like it is a device that is placed over the neck, so it will be electrolarynx. Then we need to differentiate these from the other devices. This is spongy tracheoesophageal prosthesis. Spongy tracheoesophageal prosthesis. This tube will go into trachea and esophagus. This is basically based on the principle of tracheoesophageal fistula. Then one more device which is based on the principle of tracheoesophageal voice is Blom-Singer prosthesis. Blom-Singer prosthesis. Then this would be frequently placed in the other options amongst the voice rehab devices, but this is not used for voice rehab. This is used for bronchial stenosis, and it is known as Montgomery tube. Then coming to the blocks, these are also frequently asked in the exam. This is the dorsal or external nasal nerve block. Dorsal or external nasal nerve block on the dorsum of the nose. Then we have the next one. This we will see afterwards. Then we have the zygomaticotemporal nerve block. Zygomaticotemporal nerve block in the region of zygoid bone, zygomatic bone. Then next we have the infraorbital nerve block. Infraorbital nerve block below the eye, infraorbital nerve block. Then we need to differentiate the supratrochlear, supraorbital, and infratrochlear. Firstly, supraorbital. Supraorbital is just in the midline above the eye. Below the eye was infraorbital, and above the eye in the midline is supraorbital. Then medially, slightly medially, and above the eye is supratrochlear. And then more medially, basically just above the medial canthus, this is infratrochlear block. Then we have this image. This can also be asked in the differentials options. This is in here we give the incision for frontal sinus definition, and here we give the incision for ethmoid, external ethmoid sinus. In the region of frontal sinus incision and in the region of ethmoid sinus incision. And then coming to this image, so basically the difference from the other images, in this image the eye is open. So this is the main key difference we will see in the questions, where the eye is open and it is used for nasolacrimal duct patency. We can see in all the other images, all the other blocks, the eye was closed. While here, the eye it will be specifically given open in the nasolacrimal duct patency test. So that were the most important images I discussed today for the ENT section. Thank you.